Hello! So I decided to do my project over ECT, which is electroconvulsive therapy, because it's just a really interesting therapy to me, and I think that a lot of people don't know a lot about it, and it has a lot to do with physics. So what they do is they connect electrodes to your head, and those electrodes are used to send a small electric current through your brain for about 1 millisecond. And then this results in a seizure that can last anywhere between 30 seconds and 1 minute. So the picture here is just a woman who's receiving the therapy. As you can see, she has electrodes connected to her head, and she's also hooked up to an EEG to monitor her brain activity. Okay, so ECT, it is used to treat severe mental illnesses such as severe depression, which is what it's most effective for actually, as well as bipolar disorder, schizophrenia, severe mania, and catatonia. And as you probably know, these are mental illnesses that often occur together, especially when they're in their most severe forms. So ECT is often a second-line treatment. So it's used when medications aren't working or when you need to enhance medications that someone's already on. Say like they were on a medication and then it kind of stopped working. This is a therapy you might try. And it's also used for people who are unable to tolerate certain medications that they might need for whatever reason. And also it's safe for pregnant women, postpartum people, geriatric populations. It's a really safe therapy actually for people who can't take medications. And this can be an inpatient procedure or an outpatient procedure. Okay, so there is a lot of stigma associated with ECT because originally in the 1930s they did it in a really inhumane way. Just like picture the scariest version of this, and that's what they did. They send the electric shock through your brain and you have a seizure. And there were stories of people breaking their bones and seriously injuring themselves during this procedure. Yeah, and there's also a movie and a book called One Flew Over the Cuckoo's Nest. I think that's how you say it. It's really good. But in the movie, the man is this mentally ill person receives ECT, and it looks terrifying, and he's like shaking, and there's this room full of scary doctors. It's just awful. Anywho, they don't do it like that now. So they put you under general anesthesia, so you're completely asleep, and they also give you muscle relaxers, so you don't see like the shaking, and you're not going to hurt yourself, basically, for the most part. So, yeah, and then they don't feel or remember the procedure. And then the only way you can tell they're having a seizure is by monitoring their brain activity on an EEG. And then another way you can tell is you can put a blood pressure cuff on their foot, like you can see in this picture. The patient has a blood pressure cuff on their foot, and that blocks the muscle relaxers from reaching the foot. So you can actually see the foot twitching. So you can kind of track the seizure that way as well. Okay, and this procedure, or therapy, I guess, can be unilateral or bilateral. Unilateral means it affects only the right side of your brain, so you'd place the electrodes on your right temple and the top of your head. And bilateral, you would place the electrodes on both sides of your head, and that would affect your entire brain. And there are some side effects associated with this procedure, and those include muscle soreness because you did have a seizure. Headaches are really common, nausea, and then memory loss in some cases. So Johns Hopkins has been working on kind of developing this therapy, and they have discovered that if you reduce the amount of time that you basically shock the patient, the amount of time that you let the electric current enter their head, memory loss goes down so much in patients. So less than 1 millisecond, they found, results in almost no memory loss. And by memory loss, I mean like short-term memory. People who have the most severe memory loss after this therapy would say they don't have any short-term memory, but generally it's just like you can't remember what you had for dinner the night before, that sort of thing. But yeah, Johns Hopkins is trying to just completely eliminate that, and they say that if you do ultra quick shocks, so less than 1 millisecond, you don't really see that anymore. So this therapy is usually done 2 to 3 times a week for a total of 8 to 12 sessions. So it's not just a one and done, although some people do feel effects of it after one time. It just depends on the severity of your mental illness and how effective the treatment is for you. You can have it done anywhere between 6 and 12 times. Okay, so does it work? So nobody knows exactly how it works biologically. It may change the way the brain cells communicate at synapses or flood the brains with dopamine and serotonin. But we do know that it does work. So according to Johns Hopkins, these treatments improve depression symptoms 70 to 90% of the time. And that's more than some antidepressant medications. Okay, so the physics of ECT, just the point of this presentation. So ECT uses alternating current in small bursts, like I said, less than a millisecond, to induce a seizure in their patient that lasts between 30 seconds and 1 minute. And they use this thing called electrode jelly. So they put electrodes on your head, but they put electrode jelly on the electrodes to help conduct the current. So it's a conductor, and then it also protects your skin from burns from the high voltage that they're sending into your brain. Voltage varies, but can be anywhere between 200 and 450 volts, less than 1 amp of current, and then the charge is 500 to 1200 microcoulombs. And then I just thought this image was kind of neat because it just shows the different ECT machines that are used in different countries and the voltages that these are at. So you can see some of the higher ones are around 450 and the lower ones are around 240, I guess. This machine that I have a picture of on the right is this one, the 240 volts one that's used in the US. So I just thought that was interesting to look at. And then another thing I came across when I was sort of looking this up was transcranial magnetic stimulation. And this has a lot to do with what we're learning in class because this uses a magnetic pulse to induce an electric field in the brain. And this turns out to actually be a much milder treatment. And it's used to treat milder cases of depression and can be done daily for 4 to 6 weeks. So I guess it's milder because you're not just sending the current into the brain, you're using the magnetic pulse to induce the electric field, which is kind of neat. Okay, so in conclusion, this is a interesting and revolutionary treatment that utilizes the relationship between physics, especially the principles of electricity, to enhance brain function and provide relief to those suffering from severe mental illness. So I definitely recommend you look it up if you're interested or if you want to work with people with mental illness. It's definitely a fascinating treatment to research. Thank you for watching.